Hello, welcome everyone, and thank you for joining us for the 5th anniversary of ResearchCon. We are so excited to have you here today. This is an absolute exciting day, not just because it's the start of ResearchCon, but as many of you already know, some of our young members in the CF community and their parents got some wonderful news today, which I'll touch on in just a minute. To begin though, my name is Jay Freeman, and I'm a pediatric GI and liver physician at Nationwide Children's Hospital and The Ohio State University in Columbus, Ohio. I have been lucky enough to be involved in CF research for over a decade, and I'm participating in my third straight ResearchCon. I'm thrilled to be one of your 2023 ResearchCon co-chairs. I'm joined here by my other two wonderful co-chairs, Aimee Lecointre and Dr. Sigrid Ladores. As I just mentioned, we are excited that on the first night of ResearchCon, we have just received news that Trikafta has been approved by the FDA for children ages 2 through 5 years with certain CF mutations. This is a wonderful announcement for such a great day. This gives approximately 2,250 children that will now be eligible for Trikafta, including 900 will have access to CFTR modulators for the first time. I'm so glad that we can celebrate this moment together, but I also want to emphasize that we know that while this is a critical step, there's still more to be done. Trikafta is wonderful for many people with CF, but it's not for everyone and it's not the cure. Throughout ResearchCon, I think you will hear that we will continue to push our boundaries to help all people living with CF get a treatment for their underlying cause of their disease. With that being said, and before we dive into the opening keynote, I want to share a few housekeeping items. Tonight's keynote, as well as all information sessions, will be recorded and available to registrants after the event. We won't be taking questions live during the opening keynote, but we will be offering a virtual roundtable directly after the keynote in the Sessions tab. That's where you can ask your questions to the keynote speakers. In our commitment to create a safe space where everyone feels welcome and supported, we encourage you to add your pronouns to your last name. You can do this by clicking the drop-down arrow on the right side of your screen and selecting Edit Profile. Adding pronouns allows us to easily address community members with their preferred pronouns and ensure all feel welcomed and supported. Please also remember to adhere to the community guidelines and be kind, open-minded, and respectful of everybody's opinion and their experiences. If you need to seek staff support and would like to report a violation of the guidelines, please visit the help desk located on the left-hand side of your screen. You can also visit the help desk if you have any technology problems, which I'm sure I will at some point, throughout the next 2 days. Lastly, clinicians won't be able to answer questions about individual diagnoses or treatment plans, and we encourage you to use this information you learned today to have a wonderful conversation with your care team locally. Now that I've talked too much, I'd love to pass this over to my co-chair. Aimee, please take it away.
Thanks, Jay. As Jay mentioned, my name is Aimee, and I'm an adult with CF. And I'm so excited to be one of this year's ResearchCon co-chairs. Our hope is for each of you who are joining us tonight, no matter what your connection to CF, to learn about new research and clinical care, as well as make new connections and share your experiences with others.
That's right, Aimee. So whether you're a CF spouse, an adult, parent, clinician, researcher, foundation staff, whoever you may be, our goal is for each of you to walk away with new knowledge, new questions to ask your care teams, and new relationships with others who are in attendance. Hi, everyone. My name is Sigrid Ladores, and I'm one of the co-chairs. I am a researcher, a CF researcher, CF educator, a clinician, and also the wife to a man with cystic fibrosis. This year, we're excited to offer you not only 7 data and care-filled information sessions, but we're also offering many opportunities to casually connect with clinicians, researchers, and other in the CF community. We hope you check out all the engagement opportunities these next 2 days, including a virtual water cooler, virtual roundtables to meet representatives and learn about CF Foundation-sponsored research initiatives, and small group discussions, which will close out the event tomorrow. We're also so excited that this is the 5th anniversary of ResearchCon.
Yeah, Sigrid, I honestly can't believe that we're celebrating 5 years. As I mentioned earlier, I've been fortunate enough to be a part of ResearchCon for the last 3 years now. And it's really been fun to see it grow as an event that was really kind of a unidirectional flow of information from caregivers and researchers to the community, and let it really blossom into this bidirectional flow and this sharing of knowledge and goals between caregivers, researchers, and the community. I know my research has personally benefited from these interactions, and I think it's wonderful. While ResearchCon is a place to learn about what's happening in CF research and care, it means so much more than that. Like I said, 5th year, and to help us celebrate this milestone, the CF Foundation has created this video, which I was honored to participate in. I really hope that this video demonstrates just how important ResearchCon is to all of us and what it means to a few of us who have been lucky enough to be involved over the last few years.
Every voice needs to be heard, whether you're a parent, whether you're a person with CF, whether you're a healthcare provider or researcher, or just somebody who cares.
When you start thinking about how active of a community they are and access to information, there was not a great area for them to come together with their research partners. Years ago, they were able to come to the CF conferences, but now because of infectious reasons, they're no longer allowed to in order to keep themselves and others safe. That's what's so interesting about ResearchCon to me, is this is a true access to partner with the researchers and the caregivers who are trying to improve the lives of patients with cystic fibrosis.
There are people who are afraid to use their voice. And my mom raised me she said, you have a voice, you use it. Whether it is you're talking about yourself or you're talking for someone else, you use that voice and make sure that you're heard.
Having CF and having an interest in CF research has really been an important part of the way that I, have always kind of understood having CF and coped with all the uncertainty that comes with CF.
We are bringing that knowledge and sharing the updates and sharing that passion of wanting there to be a cure together and working toward that goal from both sides of the coins, from a healthcare profession as well as from a parent.
The research community across other diseases really could learn a lot from the CF community about just how much patients and family involvement is possible and how much that can really benefit the research as a whole.
There's love. There's just a lot of love in this, to putting events like this together.
ResearchCon gave me hope because it showed me where we're going. And it showed me that doors aren't closed. And if the doors are closed, then the windows are being opened. And if they're not being opened, then guess what? We're kicking them down.
If the last 3 years haven't taught us anything, it is grace and resiliency.
Yes.
We can still move forward.
Exactly. And know that you don't have to look like me for me to care about you and love you.
And you definitely don't have to meet in person, apparently.
Right?
My primary goal is having made a connection with a provider, with another patient, with another family. That is the success of ResearchCon to me. I still have families from around the country who email me after the first ResearchCon that I was a part of. And that's what is very unique about this, is you are able to build those type of relationships.
This will always be special to me because I met somebody like Lathrania. Without being part of it, I wouldn't have had that opportunity.
I hope that people leave here not feeling alone. I want you to know that it's because of all of you that we continue to have this great event. I'm so excited that the opening keynote focuses on mental health. I cannot stress to you enough that this keynote is here because of the feedback that we have received from previous ResearchCons. We have previously touched on mental health in little small helpings, but it was very clear from the last couple of years that we really needed to shine a spotlight on this area of care. And I think we have a wonderful presentation today that is going to do just that. It is my pleasure to turn it over to our opening keynote speaker, Dr. CJ Bathgate. She is an assistant professor of medicine and clinical health psychologist at the Adult CF Care at National Jewish Hospital, and I can't wait to share her message with all of you. CJ, it's all yours.
Well, hello, everyone. I am so excited that over 1,200 people have registered for today's event. and I have the privilege of talking about mental health with all of you. So here are disclosures, none of which are relevant to today's session. So I'm CJ Bathgate, and I'm a health psychologist that works with the adult CF care team at National Jewish Health in Denver, Colorado. As a health psychologist, my specialty is the intersection between medicine and psychology, particularly the mind-body connection between having a chronic health condition and managing it in your lifestyle, which includes supporting emotional health, helping with role changes, and general support through life's ups and downs. When I finished my postdoc in sleep medicine, there was an opportunity to transition to faculty to become the mental health coordinator for our CF team. And mental health coordinators look different across the US, with some having a social work background, some being licensed therapists, psychiatrists, or psychologists like myself. And although I hadn't worked specifically in CF at that time, I was a sponge and I wanted to know everything about it. I knew that my skill set would overlap. I just needed to get to know not only the mechanics of CF, but just to learn about people's lived experiences to fully understand how I could be most helpful. I'm also a clinical researcher, and so whenever there was a moment when I realized I didn't have the answer or I couldn't find it in the literature, it highlighted new areas for me to look at. So although I entered the world of CF with a dash of luck, I fully believe it was a moment of preparation and opportunity intersecting, and I was really ready to take on my new role. So let me tell you a little story about my first day with the team. I still remember walking into the workroom for a pre-clinic meeting in 2016, and I met the whole care team, and I was very pregnant with my first son, and with family on my mind, I was struck immediately with how well everyone knew each other and the patients, and it felt like I was being welcomed into a new sort of family. And at the time, the nurse coordinators and the social workers tended to be the ones that were in charge of fielding questions about mental health concerns. But given the complexities of triaging medical issues, medication refills, and insurance, it didn't really leave much time to fully address mental health. And so when I walked in, I remember getting the general sense of, hey, oh my gosh, thank goodness you're here. We need you. And it felt good to be welcomed into the fold. And so just as I felt the warmth from my team welcoming in a discussion of mental health back then, I hope that I can make you all feel that same warmth and comfort talking about something that isn't always shared, but tends to always be on our mind. So I plan to take you on a journey highlighting how mental health has entered the chat, how it's here to stay, changes that we've seen with ETI, which stands for elexacaftor, tezacaftor, ivacaftor, which a lot of you know as Trikafta, and I'll be using those terms interchangeably throughout the presentation. We also have data on people that are not taking a modulator. We get to hear some personal stories today, which is always my favorite thing, especially with ResearchCon. And then we're going to end with what we're doing right now to address mental health and what we can do to continue as a community keeping this conversation moving forward. So since that first day in clinic, I've been lucky to witness a snowball of mental health advocacy and change. Starting in 2014, the results from the International Depression Epidemiological Study, commonly referred to as TIDES, found that people with CF were 2 to 3 times more likely to report anxiety and depression symptoms compared to the general population, and that adolescents with CF were 2 times more likely to experience those symptoms if they had a caregiver reporting elevated symptoms. So this led to a multidisciplinary collaboration between the Cystic Fibrosis Foundation and the European Cystic Fibrosis Society to form the International Committee on Mental Health in CF. In 2015, this international committee created guidelines that recommended that we screen for anxiety and depression at least once a year, providing supportive care to those reporting mild symptoms, and engaging in evidence-based psychological and pharmacological treatments for those that were reporting moderate to severe symptoms. which for some centers meant needing to provide an outside referral. To support this implementation, the foundation created a mental health advisory committee comprised of psychologists, psychiatrists, social workers, and community representatives. This committee has been at the forefront of implementation research and dissemination, and is a huge reason that mental health continues to be prioritized in CF care centers. Later that year, Drs. Alexandra Quittner, Beth Smith, and Stuart Elborn gave a plenary talk on how there's no health without mental health, and introduced to our greater medical community how untreated or poor mental health affects people physically. More pulmonary exacerbations, more hospitalizations, more antibiotic use, and poor nutritional status, which is directly related to lung health. To ensure that screenings could happen, the foundation created a 3-year grant in 2016 to bring mental health coordinators to the team, which is where I entered the chat, and I've never left. In 2019, the Mental Health Advisory Committee completed an evaluation of the grant and found that centers were successful at incorporating routine mental health screenings at CF clinic visits, and that managing mental health can have positive effects on overall well-being. So as a result, the foundation has graciously expanded the mental health coordinator program to all centers in the US and now provides yearly funding to partially support that position. The snowball effect I just mentioned could not have happened without you. The foundation has a long history of being driven by the passion and outspokenness of the community, with mental health being no exception. Although some may be nervous about opening up to their team about mental health, I will say that the progression of mental health in CF demonstrates that talking about mental health opens up another avenue that we can feel connected and better get our needs met within our CF care. So in 2022, the Mental Health Advisory Committee and the European CF Society collected data from 474 persons with CF and caregivers about their impressions of having routine mental health screenings be a part of their day-to-day CF care. 93% of respondents said that mental health is a very important aspect of their CF health. People with CF and caregivers wanted to be asked about mental health in clinic, and the majority of people wanted their results shared with the CF team so that they could be provided with more comprehensive care. The simple act of screening ignited conversations that might not otherwise be addressed, and people felt more supported by the team as a whole. And for those that did not receive screenings, they said they wished that they would have been screened because they would have wanted to discuss their mental health with someone. So the process of self-advocating and being more forthright with your emotional experiences in clinic has resulted in major shifts in the way that we can provide care and support from a whole body perspective, not just the lungs and the gut. Another recent study that focused on the lived experiences of people with CF and their caregivers is the Wellness in the Modulator Era study, which I'll refer to as the Well-Me survey. Before I start, I want to express my sincere gratitude to Erica von Sitters and Dr. Liz Yu, along with all the other researchers and community members listed above, for allowing me to present on their work, which has not yet been published, but plans to be in the near future, which we are all looking forward to. The survey was deployed in 2022 to adults with CF and caregivers that had at least one child with CF that was under 18 years old. And this survey assessed the impact of modulator therapy on the overarching domains of mental and emotional health, social, physical, experience of care, and daily living. And this study goes into such rich detail of lived experiences that I only have time to share a small sliver of what the researchers discovered. The graph here shows a breakdown of CFTR modulator use in their sample. So 64% were currently taking a modulator, with 80% of those individuals taking ETI. 9% were taking Kalydeco, 7% were taking Orkambi, and 3% were taking Symdeko. I'd also like to draw your attention back to the left, as you'll see that 36% of people in this study were not on a modulator. So 10% had taken a modulator in the past, but were not taking one now, and 26% had never taken a modulator. The PROMISE Global Health 10 is a patient-reported outcomes measure that looks at 10 different domains to assess health, well-being, and quality of life in adults and children from the general population, as well as those living with chronic health conditions. So this is a useful measure to see how people with CF compare to the general population. So before we dive in, let me orient you to this graph. So pictured here are results from two PROMISE domains, physical health and mental health. People who are taking ETI are represented by the dark blue bars. People taking other modulators are the light blue bars. People who previously took a modulator but are not on one at the time that they took the survey are the light pink bars. And those that have never taken a modulator are the darker pink bars. Higher scores mean that someone has more of that concept. So in this case, we want people to be feeling healthier and having higher scores in the areas of physical and mental health. The purple line at 50 is the US general population norm. So when you look at the dark blue bars, you see that adults taking Trikafta are similar to the US general population norms and better than adults who are taking other modulators, who have discontinued modulator therapy, or have never taken a modulator. In children, which I don't have pictured here, they found that quality of life for those taking Trikafta is similar to those taking other modulators, but better than those not on any sort of modulator at all. So a take-home finding from this graph is that people taking Trikafta have better physical and mental health when compared to people taking other modulators or not taking a modulator at all. When focusing on people who are currently taking a modulator, this graph represents perceived global change since starting modulator therapy. Dark blue represents that someone feels much better in this domain. Light blue means somewhat better. Gray means no change. Pink means somewhat worse in that domain, and red means they're feeling much worse. So since starting modulator therapy, most people report better overall health, quality of life, and physical well-being. Responses are more mixed when we look at their experience of care, social well-being, mental well-being, and daily life needs. The stars next to each category indicate that people taking a modulator were significantly more likely to report an improvement in these domains compared to people who had discontinued modulator therapy or had never taken a modulator. This last graph from the WellMe survey that I'm sharing focuses on perceived changes in emotional well-being since starting a modulator. So we can see that people currently on a modulator report declines in many areas of mental or emotional well-being. So let's take a look at anxiety at the top as an example of how to interpret this graph. So using the same color scale as the last slide, 11% reported that their anxiety got much worse after starting a modulator. 21% reported it got somewhat worse, and the gray bar represents no change. 10% reported that their anxiety got somewhat better after starting a modulator, and less than 5% reported their anxiety getting much better. With that in mind, we can see that the top areas that worsened for people since starting modulator therapy were anxiety, agitation, thinking clearly, depression, body image, feelings of stress, and sleep difficulties. So when we think about mental health, it's not just anxiety or depression, but also changes in these things listed above. And for the areas that have a star next to them, that means that there was a significant difference between reporters of current modulator users and previous modulator users, and that those that had discontinued modulators reported doing worse in those areas compared to those currently on a modulator. At the bottom, you will also see that I highlighted sense of optimism, which shows the greatest proportional increase since starting a modulator compared to the rest of the areas above. So the take home from the selected graphs I showed over the past few slides indicate that we are seeing a lot of positive changes since starting a modulator, and that there are some more specific areas of emotional well-being that are more mixed, with people reporting some areas getting worse since starting a modulator. These graphs are immensely helpful because we can start to get a clearer sense of what's going on for people starting a modulator, and it really highlights areas that are important to consider and monitor when we start somebody on a modulator. So one of our co-chairs, Aimee Lecointre, is an adult with CF, and she has had a unique experience with Trikafta that she wants to share in hopes that it may resonate with some of you that have experienced an unexpected challenge after starting a modulator. And before she starts, I wanted to take a moment to say happy birthday to her, as it was yesterday, and she's now 38 years old. And in the 1980s, life expectancy of people with CF was around 14 years old. And so you can see we've come a long ways. And a recently published 2023 scenario analysis has projected that life expectancy has increased dramatically from the addition of airway clearance medications, modulators, and antibiotics, with some projected to live in their early 80s. So with that said, happy birthday, Aimee.
Thank you, CJ. Thank you. All right, everybody. Yes, 38, feeling great. And it's all thanks to the research that's been done. And it's been incredible to witness how far we've come, like just in my 38 years. I just wanted to note that that last slide showing people were dealing with worsening anxiety and depression, I felt seen by that slide. For a long time, I kind of felt alone in some of my struggles with Trikafta. And while I hate that other people are experiencing something similar, there's also that sense of like, it feels good to know that you're not alone. So my story with Trikafta starts in November of 2019. And like everybody, I was super excited to start, but I was also trying to remain cautiously optimistic because, as we all know, these medications, any medication really, can affect each and every one of us so differently. So I started in November and went through the great purge and was feeling good physically. I could breathe. I had all these wonderful moments. One that really stands out is being able to walk up like 3 flights of stairs, dead of winter. Stairs were outside. I didn't have to stop and take a break. And that was just a really incredible experience. So I did have a really good response physically. Then in January of 2020, just a few months later, I was admitted just for a typical like standard CF clean out, 2 weeks of antibiotics, extra breathing treatments. I had just had like a lingering cough. And this hospital stay in my head should have been the easiest. I was on Trikafta. I was already feeling great. I was looking better. We're looking forward to feeling even better. Nothing significant really happened during this stay, but mentally, it was the toughest stay I've ever had. I cried myself to sleep every single night from night one. I just really wanted to isolate alone in my room. And one of the things I typically do for my own mental health when I'm in the hospital, we have a Starbucks in the lobby, and I will throw on a mask and I'll walk down there at least once a day just to get out of the room and get a treat. And I probably went like twice that stay. I thought maybe having more visitors would be helpful. And then they'd come and then I'd want them to leave because it just felt overwhelming. And it was just, I just remember feeling like this is so weird. I don't understand what's going on. And even after that stay, I continued to experience increased anxiety, Depression was getting worse. I started to feel like I was more on the verge of a panic attack all the time. And then in March of 2020, we all know what happened. How could we forget? The pandemic came, and I continued to feel worsening anxiety and panic. A few days after the everybody just go home for 2 weeks, Utah had an earthquake, and that just put me into like full-blown major panic attack, one of the worst I've ever had. And I remember thinking, like, why did I just have a panic attack? Not my first rodeo with an earthquake. We lived in California. It wasn't even the worst one I've experienced. And so I just sort of was like, okay, maybe it's just all this COVID stuff, which honestly I hadn't even really begun to process. So I started to question, like, is this because of life? Is it COVID? I had been enrolled in a clinical trial that started before COVID. So I was like, is this somehow having an effect on me? I was just very confused, but in my gut, I felt like it wasn't any of that. Can't really explain that, but that's just sort of my intuition. I decided to go back to therapy because the coping skills that I had that had worked for years were no longer helping. And I've gone to therapy on and off throughout the years. And therapy wasn't helping. It was the first time I felt like no progress was being made. I just didn't find it helpful whatsoever, which also felt odd. And that's when that gut feeling started to get stronger. Like, this is more than just COVID. And I started to question, is it related to Trikafta? I remember reaching out online, asking if anyone experienced something similar. But a lot of the responses, which are completely understandable and valid, were, yes, but I can't decide if it's Trikafta or COVID. Totally get that. Very confusing times. So I started to doubt myself, gaslight myself as we sometimes do. Like, of course it's COVID. It cannot be this life-saving medication, this miracle drug that I'm seeing everyone just like, it's changing lives for the better. There's no way it could be that. So I talked to my CF doctor. I approached him. He was actually also a part of the clinical trials. So I was able to see him in person during COVID, and he immediately made me feel seen, heard, and validated. He's like, yes, this absolutely could be having an impact. There's so much we don't know. We had really great conversations, and I think I really felt comfortable talking to him because, one, I've known him for years, and we've built up that trust, but we also work together more as a team. It's kind of like a partnership between clinician and patient, which I really appreciate. So things continued to get worse. I decided to try meds to help with my mental health. Had side effects to the first two that made it impossible to stay on those. Had a rare allergic reaction to the last one that actually lasted like 9 months and was miserable. So I worked with my CF doctor and our pharmacist from CF Clinic to adjust the Trikafta dose, which some people had reported had been helpful for them. Unfortunately, that did not help me whatsoever. So I eventually made the very difficult, heartbreaking decision to stop Trikafta. I'm fortunate enough that I am one of the people who was previously on Symdeko, so I had that to fall back on. And even though it didn't do amazing things for my health, like Trikafta, it did help to manage my health better. So I was really thankful for that. But it really, honestly, it just sucked to have to stop Trikafta. And I started to notice improvements in my mental health within just days. Everything felt lighter. I felt like I could think clearer. This weight was lifted. The panic, always feeling like I'm just about to have a panic attack, that feeling dissipated over time. The anxiety lessened, the depression lessened. And that's when I was like, I was right all along. Should have trusted my gut. But I'm just very thankful that I felt so supported by my entire CF team, that they saw me as a member of my own care team and were so supportive in this decision, because it was incredibly difficult. I'm going to turn it back over to CJ.
Thank you so much for sharing your story, Aimee. It takes an immense amount of courage to talk about personal details of your life, especially in front of a big audience. And we're really grateful to hear your perspective because it's an important one. So not everyone will experience changes in mental health after starting a modulator, but it has happened for some individuals. And it's important that we start looking into what might be happening so that we can better prepare and support people starting a modulator, those that are currently on a modulator and noticing changes, those that have chosen to discontinue a modulator, and for those that are not yet eligible for a modulator. We need to approach all of this with compassion and recognize that for some, Trikafta is a game changer. Yet for others, it might not have met their expectations, or they needed to stop to retain their overall quality of life. So over the past few years, we've been seeing more data emerge from primarily single center studies or individual case reports noting changes in mental health after starting Trikafta, as well as other modulators. These changes might include anxiety, depression, suicidal ideation, mental fogginess, and difficulty sleeping, to name a few. But it's important to put these in context. On the current labels for these modulators, there are no mental health side effects listed. And in order for a side effect to be listed on a label, at least 5% had to have reported this in the original clinical trial, which wasn't the case for any of the modulators. But it's worth mentioning that real-world users of modulators are a little bit different than those that are included in clinical trials. So typically in a clinical trial, researchers focus on people that are clinically stable, right? And they tend to exclude those with minimal lung disease. So people with an FEV1 over 90%, or those with severe lung disease. So perhaps an FEV1 less than 40%. Additionally, people may be less inclined to report an adverse event or attribute that adverse event to the study drug to avoid being removed from the trial, especially if they've had dramatic clinical improvements in their health. So current publications on Trikafta have focused on data, like I said, from single center or individual case reports, and we need more research across multiple sites and across time to figure out what might be going on, because we don't know for certain that Trikafta is the cause of the symptoms. And so we're working with a handful of hypotheses right now. Number one, it could be totally unrelated to Trikafta. It could be a predisposition that some people have and a reaction to, let's say, a life event or a circumstance in their life. Maybe there's some sort of trigger around inflammation, loss, stress, isolation, substance use. Two, perhaps the psychological impact of starting a drug has shifted someone's perspective and outlook on life that's now affecting their mood. So while some things might be very positive, there might be other things that are more mixed. Maybe someone has regret for past choices, or maybe there's a level of uncertainty around what to do next because they didn't expect to live this long. Maybe there's some survivor's guilt. Three, maybe it is a direct effect of Trikafta. So we know that CFTR is present in neural cells in the brain. So it does beg the question, what changes happen in the body now that CFTR functioning is improved? We need more information, especially about cause and effect. And number four, perhaps there's some sort of drug-drug interaction happening. We know that for some people that are taking an antidepressant and a modulator, that their levels might change in their body as a function of what modulator they're on. So in order to answer these questions, we need to research it. We need to go to the science of lived experiences. I also want to be sure to present data on the perspective of people who are not eligible for Trikafta. As a community of CF clinicians and researchers out there, I can promise you that we are going to do everything that we can to find solutions that will work for you. We will not forget about you as we press forward in this journey, toward finding a cure. In December of 2022, researchers in Rome, Italy, used interviews and qualitative analyses to describe the experiences of individuals not eligible for Trikafta that they were meeting with. Disappointment was reported by all participants, alongside mixed emotions of bittersweetness, envy, sadness, frustration, anger, and worry. Those not eligible were concerned for their health. They wanted more information about what's next for them, and while also being happy that people who were eligible for Trikafta might have the opportunity to thrive. And so this study suggests that continuing to provide integrated mental health care on the CF Care team, including regular mental health monitoring, is important because there are a lot of people that are ineligible or don't have access to Trikafta, and they may need some time to process this to help improve their coping and address disappointment that can come along with that. I recognize that tonight's focus has been on a lot of the individual changes we've seen after the introduction of Trikafta. It's also immensely important to highlight the way that mental health can affect the whole family. So I'm honored to introduce Dr. Sigrid Ladores, the spouse of a person with CF, who would like to share a little bit more about her journey with her husband and how CF affected their entire family.
Thank you so much, CJ. It's an honor to be here. Thank you to the CF Foundation for inviting me to speak, as well as be a part of the co-chairs. My world really intersects in CF, both my professional and personal lives. I wanted to share with you a little bit about why I'm passionate about the work that I do and why I teach about CF to all my nursing students. Here I am. Yes, I'm a nursing educator. I am an associate professor and department chair at the University of Alabama at Birmingham School of Nursing. I do research in cystic fibrosis. I'm a pediatric nurse practitioner and have taken care of patients and families with cystic fibrosis. But I always say that my most important role has been the wife to a man with CF. Andrew and I were married almost 23 years until he passed away this June of 2022. So he lived till he was about 49 and lived a full life. And what I always like to say is what matters is the dash between the years. So 1973 to 2022. What he has been able to accomplish in between those years is really mind-boggling. He defied the odds at every turn. He was a typical CF presentation with meconium ileus at birth, surgery at day 2. His mother was told that he may never get to celebrate his first birthday. He was that ill. He had many complications really affecting his lungs, his gut, his musculoskeletal system, reproductive issues, and so on. I mean, it really hit him hard. And yet, despite all of that, he persevered. He graduated with his bachelor's in psychology. He had a master's in social work, and he eventually became an attorney with his JD. In fact, he started law school when his FEV1 was in the low 30s. So he was the old in the back of the room with oxygen in his nose. But he continued to go to school and, in fact, was inducted into law review before he graduated. He received his bilateral lung transplant after his first year of law school and took 2 semesters of medical leave, but then came back strong and graduated with top honors. He became an attorney who specialized in educational law and family law. He was also a father. You'll see here pictures of our boys. He was a proud dad of 2 boys, both from fertility treatment, because CBAVD, and we needed the help of science and our amazing fertility team to be able to become parents. He was a businessman. He coached. He loved sports. He worked out all the time. And he was also president of a CF camp where he contributed back to the CF community. This was really a roller coaster ride. with this whole CF journey that involved me strapped next to him and our sons. And so I wanted to showcase some pictures here because you'll see at the very bottom right picture is me doing a portacath access demonstration in front of my nursing students. But if you take a closer look, you'll see my 15-year-old son, he's now 15. Back then he was 5, peeking underneath my left elbow, helping, I'll put that in quotes, helping and assisting with a central line dressing demonstration. We always involved our family. We involved our boys. We spent many holidays and birthdays in the hospital. At that point, he went in the hospital pre-transplant, went in the hospital 3 or 4 times a year, and each time was about 2 to 3 weeks. So yes, it affected not just Andrew, it affected the whole family. So now I'd like to highlight 4 groups of people that are truly affected and potentially have you think about the issues to consider in order to fully support the whole family. So the first group would be, coming from my experience, that would be the spouse. The spouse caring for someone with CF. We can't neglect them. CF places additional burdens on the marriage, on the relationship, especially when there are children involved. I remember I had to be the strong one. I had to put my own stressors and anxieties and fears aside because I had to focus on what my husband needed at that time. I still had to go to work. He was on my health insurance. So regardless of how I felt or needing to be, in the hospital with him, I still had to maintain full-time employment because our insurance was on my job. The guilt, mother's guilt is real. The guilt of being away from my children, especially when Andrew was in the hospital. I felt torn and I wanted to be in 2 places at once. There was a period during his lung transplant and some complications that he experienced after transplant where we were in the hospital for about 100 days straight. And so I lived in the hospital room with him for that 100 days. And we had a toddler at that time who I then had to arrange so that my mother-in-law could come live in my house. And our Asher hopefully did not feel the brunt of a major change in the household by having his own, familiar things around him. Compassion fatigue is real. From my lived experiences, while I loved Andrew, married almost 23 years, I also felt resentment at times because I felt like he was sucking literally the energy and the life out of me while I cared for him. And certainly after his death, I felt a lot of a variety of different emotions. I questioned, how do I keep on? For me, Andrew's death also led me to question if I should continue the work that I do in CF. His death really affected both my personal and my professional identity as a researcher. The second group that I'd like to highlight would be the parents of children with CF. Parents would tell me they feel a lot of guilt because they said, I gave it to my child. I didn't know that I was a carrier. How could I do this? There's survivor's guilt, especially when the parent have to bury their children at a young age. Parents have told me this is unnatural. It shouldn't be this way. It's wrong. The third group would be the children of adults with CF. So growing up with parents who dealt with life-threatening health crisis after crisis and being shuffled from one house to the next, perhaps if there's an extensive hospitalization, all of those things really affect the child or children. These children worry about their parents, especially the parent with CF. And depending on the child's age and developmental stage, they can become angry at their parents for the instability that CF inherently brings to their family unit. And lastly, we can't forget about the siblings of those with CF. Growing up and feeling like they're the second-class citizens, end quote, and feeling neglected because their sibling with CF required so much of their parents' attention and care, that all has mental health implications. So these are the groups that I wanted to bring forth to your attention so that we can think about different ways to support them. And we definitely need additional research on these issues. Thank you for allowing me to share.
Wow, thank you so much for sharing your story, and Andrew with all of us. He's an incredible man and father and all those things that you told us about. And I very much appreciate your honesty and rawness around this very painful situation. You bring up a lot of very important points as clinicians and researchers we need to be thinking about. This really highlights the need to address caregivers and families. And I will say, the CF care team also experiences different levels of grief too, right? We've got the grief over the person who was taken too soon. And we also experience a level of grief about no longer seeing our patients' loved ones that we have grown to know and support over the years during many of life's milestones and changes. So for a deeper dive and access to more mental health resources, it's as simple as heading to cff.org to learn more. They've worked very closely with the Mental Health Advisory Committee to create resources on a variety of topics that I've listed below, and are constantly creating more based on your feedback. I've been mentioning the Mental Health Advisory Committee throughout this presentation, and I wanted to formally recognize the clinicians, community members, and researchers that have dedicated their time to keep mental health a part of the greater CF care dialogue. I'm also excited to announce an adjacent mental health research working group that was just created this year to continue tackling some of the community's concerns around mental health. This group is full of experts in psychology, psychiatry, pharmacy, basic science, clinical translational research, and community members. And our initial priorities are to start figuring out some of the things that I've talked about in today's presentation, right? What is the potential link between Trikafta and mental health changes, as well as some of the other priorities that have been brought up, such as body changes and nutritional aspects of CF that we've seen shift, among others. And so now I have a call to action for the community about what you can do right now. So first, talk openly and often with your children, partner, family, and friends. Those closest to us know us best, and they might be a good compass and gauge of how things might be changing over time. They might be the first to see that we're struggling, and also the first to celebrate our big wins. Second, if you're not sure about something, bring it up in clinic. I recently met with an adult who was experiencing significant brain fog and chalked it up to getting older and didn't want to bring it up because he thought this is just part of the normal aging process. But after we talked and I got more information, we realized there might be something else going on here. And we've been able to loop in other treatment team members to come up with a plan and provide him with some options of where he can go next in order to address his concerns more thoroughly. If you're a parent and your child is acting differently, instead of just assuming, oh, that's just what kids do at this age, it might be worth running it by your team and getting a referral to a mental health provider just to get a more in-depth assessment and opinion. Third, discuss with your doctor if there might be different ways to address any symptoms you're having after starting a modulator. So recently published articles have suggested that changing the dosing of Trikafta to perhaps 1 pill in the morning instead of 2 might alleviate symptoms. And for some, flipping the morning and evening dose has helped alleviate symptoms. And for others, some people have had success adding in an antidepressant to their regimen so that they can address their mental health symptoms and continue to receive the benefits of Trikafta without any sort of reduction in dosing. And last, keep connecting as a community. Keep this dialogue going. After this keynote, there'll be a number of breakout sessions, and one will focus on this talk and allow people to come in and have more of a conversation about the topics that I've covered. And so just keep all of these things in mind to ensure that you are getting whole body care, which is what we intend to provide to you. So with that, I want to give one more thank you to Aimee and Sigrid for sharing their very, and turn it back to our other co-chair, Dr. J. Freeman.
Thank you, CJ, and echo your sentiment. Thank you so much, Aimee and Sigrid, for your personal stories. I hope you get a chance to look at the comments. You've clearly connected with some people out there, and I hope you get a chance to see them virtually, at least during ResearchCon. Before everybody goes, please take some time filling out the satisfaction questionnaire under the poll tab on the right-hand side of your screen. We now have about a 25-minute break or so. If you'd like to go to the Sessions tab, you can speak with CJ, Aimee, and Sigrid on the Mental Health Research Working Group that was just brought up and ask any of your questions from today's keynote. You can also visit the Sexual Health, Reproduction, and Gender Research Working Group virtual roundtable hosted by Dr. Anna Georgiopoulos. After that, we will dive into 4 information system sessions at 8:15, followed by a 45-minute extended Q&A for each of those sessions. Thank you so much. Hope you enjoy ResearchCon, and I hope to see all of you at the different sessions. Have a great evening.